Hello again, everyone. Our third talk of the day will be given by Dr. Maan Awad. Dr. Maan is a PG/1 internal medicine resident at King Saud Medical City. Dr. Maan will be talking on getting the best out of your internship year. Dr. Maan, thank you for agreeing to give this talk, and you can start whenever you're ready.
Right. Thank you very much. Okay, Assalamu alaikum wa rahmatullah. My name is Maan Awad. I am a graduate of Alfaisal University, and currently I am a first-year internal medicine resident at King Saud Medical City. First of all, I would like to thank the International Office for giving me this opportunity and for organizing this talk. And inshallah, it will be beneficial for those who are attending with us. And inshallah, ربنا يوفقكم inshallah you match in your desired specialties. If nobody has an objection, I would like to continue in Arabic, if it's okay.
They're saying okay.
تمام. طيب, let me share my screen. طيب, بسم الله الرحمن الرحيم. Getting the best out of internship year. طيب. طيب, في البداية يعني سنة الامتياز هي السنة اللي تفصل بين كون شخص طالب في كلية الطب وبين بداية الريزيدنسي. طبعا السنة هذه هي ترانزيشن يير، فأنت عندك هدف إنه بنهاية هذه السنة بإذن الله تنقبل في التخصص اللي أنت تبغاه في المركز التدريبي اللي أنت تبغاه. عشان تحقق هذا الهدف لازم تكون معاك يعني زي ما تقول العوامل اللي تساعدك على تحقيق هذا الهدف. فشيء مهم جدا إنه يكون هذا الهدف واضح بالنسبة لك، لأنه بناء عليه أنت راح تبني جدول الامتياز حقك، راح تخطط متى تاخذ الاختبارات، متى تسوي الالكتيفز حقتك. تمام. وطبعا زي ما قالت الدكتورة منادين قبل شوية إنه هذه زي ما أنتم شايفين التقسيمة حقت الدرجة التراكمية أو الأجريجيت سكور، 30% منها على الجي بي اي. فهذه خلاص يعني ببداية سنة الامتياز ما تقدر تسوي فيها شيء، انتهت. اللي يبقى لك هو اختبار ال SMLE ونقاط السيرة الذاتية. طبعا نقاط السيرة الذاتية غير عن موضوع السي في الشخصي حقك، يعني في اختلافات بينهم شوية. تمام. بس زي ما انتم شايفين انه اختبار الرخصة السعودية او ال SMLE عليه 50%، فهو في النهاية هو أهم عامل أو أهم شيء لازم تركز عليه في سنة الامتياز. فلذلك أفضل، يعني طبعا ما في شيء صح أو غلط، أنا الآن قاعد أتكلم من تجربتي ومن تجربة زملائي يعني اللي حوالي واللي شفتهم، فممكن كلامي يكون صح ممكن يكون غلط، بس هذه التجربة اللي مريت فيها. أعتقد إنه أفضل شيء ممكن تسويه بالنسبة لاختبار ال SMLE هو إنه تأخذه في أقرب فرصة ممكنة، يعني في بداية سنة الامتياز. طبعاً إحنا نخلص الدراسة تقريباً في ماي، فعندك على الأقل شهر جون، واللي بدأ هذه السنة مثلاً في أغسطس وزي كذا كان عندهم فرصة إنه يذاكروا للاختبار مدة شوية أطول. أيوة.
Sorry to cut you off, but there are some attendees that are requesting for you to speak in English because they don't understand Arabic. Is that okay?
Okay, sure.
Thank you.
Okay. So, as you can see that this is the distribution for the cumulative grade that you have, that you are going to use in order to apply for residency in Saudi Arabia. And you can see that 30% of it goes for the GPA. So by the start of internship, you cannot do anything about it. However, you can do something about the remaining 70%. You can see that 50% is of your grade, of the aggregate score, is allocated to the SMLE exam, and 20% to the CV points. And these 20 points that are related to the CV, they are different from the regular CV that you have. They are actually questions that you will find on the Match website, and based on your answer, you get the points, okay? And we will get to its, we will get to the details of the 20 points of the CV later on when I talk about how to apply and about the application process. But when it comes to how you can, utilize your internship year in the best way possible, I think from my experience, and I just said that a few moments ago, that at the end of the day, this is, my experience and my opinion. So it might be right or wrong. However, in my opinion, I think that the most important factor, or the most important thing that you have to focus on, is the SMLE exam. And in my opinion, I believe that the best way to deal with the SMLE exam is to take it as early as possible in your internship year. So we finish 5th year at around May, and at least we have 1 month, which is June, before the start of the internship year. And I think that this is actually a very good time to study for the SMLE exam, and I highly recommend taking the SMLE exam as early as possible, so maybe on June or August. So why take the SMLE exam early on? It has 2 benefits. First, if you get, first of all, you have some time to study for it. So you can study for it, and then if you get a good grade, a high grade, then you will be less stressful about this exam. Meaning that after that, you can, focus on your rotations in the internship year, and focusing on other things such as the electives or research opportunities. So you kind of get the SMLE exam out of your way. However, if you get a low grade or a grade that you are not satisfied with, well, still you still have a long time to retake the exam multiple times, and you will learn from from the first exam. You will learn. Maybe you can modify your studying method, or search for better online resources to study for the exam. And as Dr. Nadine mentioned, that for the most part, the SMLE exam is all about the question bank. However, you need to just make sure that your source of the question bank is a reliable one. Okay, so I think this is number 1 on how to benefit from your internship year. The second thing is that, and I will get into details on the research. This year, the research points, there are 6 points for research, okay? And 4 of them are very easy points to obtain. So I highly recommend, as a medical student, this is my personal opinion, that don't go into, primary studies like cross-sectional or observational studies. Just focus on 2 types of studies, either case report or review articles. Why? Because these 2 types of research depend on you. So how much effort you put, then the time is going to be corresponding to that. Meaning that for the case report, for example, you get the case, it's up to you if you want to work on it for 3 days or 1 week or 1 month. At the end of the day, it depends on you. You don't have to ask the doctor who's busy seeing patients in the hospital to contribute that much. So I think that these 2 types of research are very convenient in being in the sense that you can finish them very quickly. within a period of 1 month, you can, get done with writing the manuscript, and then it's just the process of submitting it to the journals and waiting for the acceptance and publication. So 4 points are very easy points, and then we have 2 points for participation, which I will get into details when we talk about the CV points and the registration process. So again, the SMLE exam is the most important one, and my recommendation is to get as high a grade as possible, regardless of the specialty that you want. Yani, even if your specialty is not a competitive one, just get the high grade. Make your cumulative GPA as high as possible, because you never know. You don't know the grade that the specialty is going to stop at. So get as high, an aggregate score as possible. And then we have the second most important thing. So in the matching process, first, you match into the city. So let's say, for example, I applied for internal medicine residency. I have to specify in my application whether I want the city that I want to match in. Okay, so I can choose, Riyadh, Jeddah, Medina, Mecca, whatever. Let's say that I matched into internal medicine in Riyadh. خلاص. For the most part, the SMLE exam or the benefit of the aggregate score is done. You need your aggregate score to be high in order to match into the specialty that you want in the city that you want. After that, after the first match, this is the first match. After the first match, you have the interview season. So depending on the interviews and how they go, you will have the second match after that. So a big part of enhancing your chances to match into the program of your interest is the electives. So during your internship year, for example, I have applied for internal medicine residency program. I was able, or as a graduate of Alfaisal University, we can do 4 months of internal medicine. 3 months are required, and then 1 elective month, which I chose to do in general medicine. However, I actually made a mistake when it comes to doing electives in internship. The mistake that I made was putting all of my eggs in one basket. So I did all of my electives in one center, and that was a big mistake, because you never know how your interview is going to go, even if you get, letters of recommendation from that center. At the end of the day, when it comes to the interview day, you might not, see the doctors who you work with, and it's better to, make your options open and do electives in as many centers as possible. So if you are aiming for an internal medicine residency in Riyadh, do electives in KFSH, in KFMC, in National Guard, in as many centers as possible. Because from what I have experienced, whenever I go into an interview, they would ask me, did you do an elective in our hospital or not? Regardless of, I don't think that they were focusing on whether I did it in December, January, or February. You can do it at any time. However, at the end of the day, you need to do, an elective in their hospital. And even if you said, no, I did not do it, they will ask you, well, where did you do your internal medicine rotations? If you mention just one hospital, then they will, get the idea that that hospital is the hospital that you would like to match in, and it's actually true. So my recommendation is, the bottom line is to do your electives or your rotation in the specialty of interest in as many centers as possible. Okay, so this was the end of this brief talk. If you have any questions, please feel free to ask.
All right, thank you, Doctor. There are a few questions in the chat.
Okay, let me see. How do we know if a specialty is allowed for foreign medical graduates or not? And how does applying differ? Honestly, I don't have a clear, information about that for foreign medical graduates. But from what I know, and this is, I don't have like a solid source for that, I don't think that foreign medical graduates are eligible to apply for residency in Saudi Arabia. However, I'm not sure, 100% sure about this. But for example, from my colleagues in my batch, I don't think that any of them applied for the residency match. يعني نذاكر له من سنة خامس لا الSMLE ما يحتاج تذاكر له يعني من بدري، لأنه في النهاية هو تجميعات أسئلة. الشيء المهم هو إنه لما خلاص تخلص سنة خامس أهم شيء إنك تذاكر الSMLE، تجميعات أسئلة تحفظها، تدخل الاختبار وإن شاء الله تحل كويس. لكن مهم يعني my recommendation is to do the exam as early as possible عشان بس تعرف وضعك يعني. If you get a high grade, خلاص you will be relaxed. You will just focus on improving your grade. However, if your grade is not, it was bad, for example, you still have some time to, study and retake the exam later on. You recommend taking SMLE at the beginning of 5th year? I think you can do that. However, I don't think it's necessary. It's up to you. At the end of the day, it's your decision. It's okay. It's not going to harm you in any way. So sure, why not just to get an idea on how the exam is. How many chances I have for SMLE? I believe you have 4 chances, if I'm not wrong. And if someone knows, please correct me. Yeah, I think it's 4 times. طيب, is taking this will benefit me? USMLE? USMLE, so from my experience, honestly, I don't think it adds very much, to be honest. The SMLE exam is its own exam. Just you need to study the question bank. It's not related to this USMLE. The USMLE, maybe you will have a good solid background. However, without studying the question bank, I don't think that you will get a good grade. You need to study question bank regardless. I don't think, bottom line, I don't think that the USMLE is going to benefit you very much. Many of those who got very high grades in the SMLE exam did not take the USMLE exam. So I don't think it's relatable. Does anything other than my GPA matter during medical school? Or should I work on more things? What I suggest is at least get a publication. While you are a student, just focus on getting a publication, at least. Because, for example, this year, you have 4 points given for a publication. 4 points, this is significant. So just get a publication. It will make your life easy. I heard that there are points for interest. So you can write your specialty in many cities to show them you are interested in this specialty. But what if I got accepted in Jeddah and I'm interested in Riyadh? Can I ask for a transfer? صحيح, there are points for strong interest in a specialty, that you get, and we will discuss this later on in the application talk. طيب, if you get accepted in Jeddah and you are interested in Riyadh, can you transfer or not? Honestly, I don't have clear information on this, but what I'm going to tell you is the experience of one of my colleagues. So he got accepted in a city outside of Riyadh, and what the program director in one of the centers in Riyadh told him is that, so you need to complete your first year over there, and then you ask for a transfer. However, for the transfer to be successful, the program director in your center outside of Riyadh has to agree, and the program director in the center that you are interested in Riyadh has to also agree. So both program directors, they have to be on board and agree to the transfer. What are the reliable SMLE question bank? I think that this is highly variable. From one year to the other, it changes a lot. يعني during my time كان في sources called Penguin و Glory, بس هذول يمكن قدام, ما أدري إذا, I'm not sure if they are still there and they still exist or not. But what I suggest regarding having a reliable SMLE question is to ask your colleagues and to join WhatsApp groups, sometimes Telegram groups, in order to know because it changes from one year to the other, so you have to be updated. And honestly, I'm not updated on the highly reliable SMLE question banks, but what I suggest is just ask your colleagues, those who are around you. There is a 3-point for student interest. أي صحيح. Other than the questions bank. طيب. For the SMLE exam, I just suggest I highly recommend the question banks. That's it. I don't think that other sources are going to be very much of benefit صراحة. لا USMLE ولا Toronto Notes. Maybe Toronto Notes لأنه I think that the SMLE exam is a bit similar to the Canadian exam. So maybe they have the same resource, but at the end of the day, because when you take the exam, you will notice that most of the questions are repeated. Most of the questions are repeated. So if you study the question bank, you will get the same questions, and you have the answers ready. So just memorize them and go into the exam. Does choosing the time of the exam will affect the amount of repeating questions, like in the beginning or middle of the month? Maybe sometimes, sometimes. However, this is also variable. Most of the people, most applicants, they want to take their exam at the end of the month, so that they can take a look at all the questions that were there at the beginning of the month, because as we said, the questions are repeated. However, I remember last year, people were doing this, and for some reason they changed the questions in the middle of the month, so it can change. You just pray that the questions are going to be repeated. However, sometimes they change them, and I don't think فجأة كده يغيروا لك الأسئلة. But for the most part, they are repeated questions. لا, the USMLE is very different from the SMLE. طيب. ما شكلت درجتك USMLE سلاح ذو حدين لما قدمت؟ هنا ما قالوا لك أنت مخطط تطلع برا؟ أي هذا سؤال مهم جدا. When you apply for residency here in Saudi Arabia, the committee that is interviewing you has to do with the residency in Saudi Arabia alone. Okay, so this is something very important. Don't think that having the USMLE actually might actually affect you negatively. Yani for the most part, it depends. I think it depends on the specialty. But for example, internal medicine, if you show them your USMLE score, it will be negative. Bottom line, it will be negative. So don't mention the USMLE. Tell them that you did not take the exam. Because at the end of the day, the committee that is interviewing you has to do with the residency in Saudi Arabia. They are not going to, there is another committee for scholarships for, sending applicants abroad. But for the residency in Saudi Arabia, those who are interviewing you, they have nothing to do with, giving you a scholarship for the most part. They don't have, they are mainly concerned with the residency in Saudi Arabia. So be careful whether or not you use your USMLE. I highly recommend not to put your USMLE. If you have taken the USMLE exam, don't put it in your CV and don't mention it in the interview. And if they ask you about it, tell them that you did not take it. What resources would you recommend for the SMLE? Again, it changes from one year to the other. Honestly, I'm not updated with the question banks. However, I highly recommend to ask around your colleagues, because this is the difference in internship year. You don't have a specific resource to study for and pass the exam. In the internship year, you have to ask your colleagues, join WhatsApp groups or Telegram groups in order to be updated and get the most recent information and question banks. How do you know the center you are applying in is good for the specialty you are interested in? I think if you are applying for residency in Riyadh, and for the most part, Riyadh has the best residency programs, I think, in Saudi Arabia. But to know whether the center is good for you or not, I think by doing an elective or a rotation over there. And this is actually the benefit of doing rotations in multiple centers, because first of all, they will know you. All the centers will, if it is like, for example, internal medicine, they will want you. And it will become in your control whether which center you choose. So it is very important to do rotations in different centers, so that at the end of the day, you have a mature judgment on which center that you are going to choose. صراحة الدورات حقت الميديسن والسيرجري الصراحة ما أعرف. أنا صراحة ما جربت، ما دخلت في ولا دورة. ممكن في ناس جربوها واستفادوا منها، ولكن أعتقد حتى لو سويت الدورات لازم تلقي نظرة على التجميعات. لازم التجميعات لازم تمر عليها في النهاية. لا عادي. letters of recommendation, the value of the letters of recommendation comes after the first match. So after you match into, for example, internal medicine in Riyadh, the centers will start sending you, interview requests. So when they send you, they will tell you, for example, send us your ID, your passport, and whatever. And they will ask for at least 3 letters of recommendation. So during your internship, it is recommended to get letters of recommendation, at least 1 letter of recommendation each month, so that you can, choose the letter of recommendation that you are going to send for each center. For example, if you are having your interview in KFSH, then you can show them your KSMC letters of recommendation. If you are applying to, if you are interviewing with National Guard, you can show them letters of recommendation from their hospital. But it is not harmful to have letters of recommendation from different specialties. For example, I had 3 letters of recommendation, 2 of them internal medicine, and 1 of them was thoracic surgery, which is not related to my specialty of interest. But at the end of the day, it's just a requirement, the letter of recommendation, just to send them to them. I don't think that the letter of recommendation is something that they highly consider. It's just a requirement. You are required to provide 3. So you have to just, show them the 3 letters of recommendation. At least in internal medicine. Is the SMLE material everything we have studied in med school? Yes, you get mainly the clinical part of medicine. So the exam has questions from obstetrics and gynecology, internal medicine, general surgery, and pediatrics. If I did an obligatory rotation in, for example, in GS, do I have to have electives also in GS? طبعا, for us as Alfaisal graduates, you have 3 surgical rotations that you have to do. At least 1 of them has to be in general medicine. The USMLE harder than, I think that the USMLE is more challenging. يفرق في من أي department أخذ the recommendation ولا? I already answered this. How do we get the letters of recommendation? Just at the end of your rotation, you can approach the doctor or the consultant with whom you have worked with politely and ask for a letter of recommendation. You can, ask for it in a way first. So first of all, you can ask the doctor to give you feedback. So you can ask them, what's your feedback? Any feedback on my performance? Any recommendations or criticism? And depending on their feedback, you can ask for a letter of recommendation. If it was a good feedback, you can ask them, well, I'm applying for residency this year, and I would really appreciate it if you can give me a letter of recommendation. It will help me a lot in my application. And for the most part, you will not face, I don't think you will face difficulty getting a recommendation letter. I cannot, remember any of my colleagues having a difficulty getting a letter of recommendation. So just ask for it. And for the most part, they will tell you, most of them, they will tell you, okay, just go to the secretary, give them your name, and they will send you the letter of recommendation.
Doctor, we'll take the rest of the questions in the panel session at the end. Since we are short on time, we'll move on to the next session. Thank you for the presentation, by the way, Doctor. It was really informative. We will move on to the next talk.